For the next talk, we step even 1 year further back and invite Professor Gerald Zöch from Vienna, Austria, where he's working as a plastic surgeon and has a long-standing experience on the board of the Austrian Wound Association and now being an advisor for the health government in Austria on the topic of chronic wounds and diabetic foot. He will speak with a 2-year perspective now on the outcomes on the Austrian Diabetic Foot project, which was initiated at the EWMA meeting in Vienna 2 years ago in 2012. So, Professor Zöch.
Thank you for your kind introduction. When we started when we had the EWMA meeting 2012 in Austria, EWMA asked me what project you would prefer to introduce in this opportunity. And I said, we have a problem with diabetic foot in Austria. And we had this meeting in 2012, and what happened since? We wanted to have a register for major amputation, and we are now lucky that we have this so-called AIQI for amputation. I will explain it in one moment. We had specific training for doctors and nurses, and what we tried is to reform the reimbursement. So we are lucky that we have some changes in the hospital and health insurances now, and so we can start with a so-called shared care concept. We have no task force. It was not possible to create the task force. We are still a 2-man team undervising the Ministry of Health. We have a good contact. I have a good contact to this authority now, and therefore we have some changes. What is AIQI? It's the Austrian Inpatient Quality Indicators. Sylvia Türk is the head of the Austrian Quality Department in the health, in the Ministry of Health in Austria, and she has implicated this tool. This program includes all hospitals in Austria. There are 205 hospitals in Austria, and this measures quality data from routine data. We have the so-called leistungsbezogene Krankenhausfinanzierung, that's treatment-related reimbursement. And every doctor has to document what happened with the patient after dismission. That includes treatment and also diagnosis. And from this data we can calculate the outcome of the patients in some special treatment and diagnosis. And so we did it for amputation. With a non-traumatic, non-tumor major amputation, we had a mortality in 125 hospitals of 13%. And the next steps are that we, until the next year, that we can describe diabetes and vascular diseases and former admissions and operations and the follow-up of these patients. Therefore, the patients have to be anonymized. So we have the first data from major amputations in Austria. I presented the data from 2006, and we had an amputation ratio from 31% per 100,000 patients, and we started in 2007 concerning the major amputations, and surprisingly we have now lower results with 21.7 compared with the German publication in the 3 months ago. We are nearly in the same level. If you estimate how many diabetic major amputations are, we are now by 10. As I pointed out, we have a change in the education of our doctors starting next year. And what we could achieve is that we have wound management as a part of this post-graduating training for all residents, also for the practitioners as well for the surgeons, orthopedics, and so on. And it includes also diabetic foot treatment. And what we also achieved is now a certified further training in wound management after training, finishing training. Peter Kurz started with education of nurses according to the International Working Group of Diabetic Foot, with screening, examination of the diabetic foot, and so on. We start with this program in this year. What also happened is that the Austrian Ministry of Health recently founded a working group focused on patient education, not only for diabetes, but especially for diabetes. It's called Living with Diabetes, Leben mit Diabetes, and also includes the education of the diabetic foot. And the next step is that we have a pilot project, Meine Praxis 24 hours. That means that we have a 24 hours treatment in outpatient clinics, and with new concepts of primary care, primary treatment, best practice. That means that in these clinics, not special foot clinics, also including treatment of diabetic feet, but also for all of the problems the patient have 24 hours a day. That we want to get off the patients from the ambulances of the outpatient of the hospital to special ambulances for treating that. We have problems with guidelines. We are not so lucky as many other countries to have guidelines. I've seen the same problem in the northern countries. And the problem is when we have a scientific association, like the Diabetic Association, also have to make guidelines. They are forced by the Ministry of Health to do that. But we have the problem that we have 9 states, Bundesländer, with their own with their own rules, and we have the problem that the Medical Association, the Chamber of Industry and Economics, and also the head of the insurances in Austria have to give their agreement to these guidelines, and that is a little bit difficult now. But also we have the problem with the reimbursement, and therefore we have still barriers for introducing neuropathy screening, but we are hopefully looking forward to we can solve this problem in the future, and I can give you better results in the future. Thank you for your attention.